Good afternoon, everybody, and thank you for coming to our Cole in the community. This is Cole Academy, and today we have one of our own BCaBAs, Miss Justine. Justine is one of the most outstanding therapists that we have here at Cole. She's soon to be BCBA. She just graduated with her master's, which we're so excited about, from her fancy smancy Pepperdine University. And we are just so thrilled to have Justine. I can speak as a former parent of one of her patients here at Cole. She does an outstanding job as a transitional manager in programming for our children in an ABA treatment, and really making sure that our kids have those school readiness skills as they move on to their next steps in the community. So she's just a huge wealth of resource and asset to us here at Cole. And we're really excited to have this presentation. So without further ado, I'm going to turn it over to Justine. Please feel free to put anything in the chat box so that we can address during the Q&A, and I'll turn the recording off once we get towards the end. So Justine, it's all you now. Thank you.
Thanks, Wendy. So as Wendy said, I'm Justine. I'll just do a little quick about me. I am a BCaBA. I became a BCaBA back in 2017. I've been in the ABA field for about 4 years now, but I have been working with adults, children, and teens with autism since 2016. I am our transition program manager at Cole Academy, so I help run the bridge program that we have here, and I love Cole. It's great. I love what we do, but specifically talking about diversity in ABA, I chose this topic because during getting my master's, I did take a multicultural class, and it really opened my eyes about different cultures and diversities that we handle on a day-to-day basis, not in our own personal lives, but also what we do here with our kids and with the family and communities, and how, especially with everything that has been going on in 2020, it's really, I think it's a very important thing to practice in our field, and it's not really like research right now. And so I just kind of want to bring attention to it, and us kind of just being culturally aware when we are providing services to our kiddos and their families. So I'm going to turn off my camera now as we go through this presentation, and we will get started. If I can, okay. So. Cole in the community. Diversity in ABA, how to be culturally sensitive while implementing ABA. So just a little fun fact, the US Census Bureau predicts that by 2044, the United States will become a majority minority nation, meaning that no group will have a majority portion of the total population. Therefore, training on working effectively with individuals from diverse backgrounds is critical. So what is culture? I have 3 definitions for you guys. So, of course, B.F. Skinner's in here. He defines culture as the social environment is what is called culture. It shames and maintains the behavior of those who live in it. I also have Franz Boas. He defines culture as the system of shared beliefs, values, customs, behaviors, and artifacts that the members of society use to cope with their world and with one another, and that are transmitted from one generation to another. and I have good old Merriam-Webster. They define culture as the customary beliefs of, customary beliefs, social forms, and material traits of a racial, religious, or social group. Sorry, my arrows are not working, so my scrolling is what we're having to deal with right now. So culture is always evolving. Therefore, becoming culturally competent is a lifelong endeavor that needs continuous improvement. Because culture underlies much of our behavior, and understanding the differences in cultures and how to work effectively with individuals from diverse backgrounds is critical when working in applied settings, of which we do. So as we know, all individuals are a part of at least one culture. The behaviors that embody a culture include the way we socialize with others, the language we use, and the specific words within a language, our religion or even no religion, the way we solve problems and make decisions, the gestures we use, and so on and so forth, what we eat, clothes we wear, so much embodies our culture. Today, behavior analysts are faced with vast opportunities to both understand the social and cultural conflicts as demonstrated behavioral problems and engineer more peaceful and sustainable in a sustainable world. So what is competence? So according to the BCaBA guidelines, behavior analysts need to stay in boundaries of their competence, but also behavior analysts must continuously improve their level of competence for providing services to all populations. What is cultural competence? So here we have the definition from the U.S. Department of Health and Human Services. They define cultural competence as it comprises behavior, attitudes, and policies that can come together on a continuum that will ensure that a system, agency, program, or individual can function effectively and appropriately in diverse cultural interaction and settings. And here we have cultural humility. So this, I'll say that based on things that I've been reading and hearing what more not only BCBAs talk about, but I feel that we are shifting from competence to humility because the National Institutes of Health defines cultural humility as a lifelong process of self-reflection and self-critique, whereby the individual not only learns about another's culture, but one starts with an examination of her or his own beliefs and cultural identities. And I think this is I think it's a good shift that we're making because, in a sense, that being competent in something can be applied as you learn something, this is a skill you already have, and then you're done with it. So what we can do is challenge our assumptions and beliefs about that culture, and we self-reflect because in reality, we can never be that competent in a culture that's not ours. So Terry Cross conducted a study on cultural competence, and based on his findings, he provides 5 essential elements to help become more culturally competent, or now in ways to have a little bit more cultural humility. So the 5 essential elements are valuing diversity, having the capacity for cultural self-assessment, being conscious of the dynamics inherent when cultures interact, having institutionalized culture knowledge, and having developed adaptations to service delivery reflecting an understanding of cultural diversity. And we'll go kind of more into, with these essential elements, how do we develop the cultural awareness? So developing cultural awareness. Cultural identity is defined as characteristics that extend beyond individual differences to those traits that members of a given culture share with one another. Behavior analysts are recommended to concurrently engage in cultural awareness practices concerning their own behavior as well as those of their clients. So, we need to have that openness and flexibility in the presence of various cultures, which will hopefully result in better outcomes for those that we serve. I kind of wanted to provide an example of this, is that kind of knowing a person's family or home culture will likely have distinct qualities and behavioral expectations than that of your work culture, school culture, even like your social group. Because the overall purpose of practicing cultural humility is to be aware of one's own values and beliefs, and it is important to understand that those notions come from the combination of all of these cultures and that people experience it differently in their everyday lives. A person cannot begin to understand the makeup and context of another person's life without being aware and reflecting of their own background and situation first. So just overall having that awareness, not only of others, but of yourself too, is gonna benefit us. So going on to benefits. Some benefits of being culturally aware is determining cultural identity, allows behavior analysts to develop an awareness of a client's personal cultural values, preferences, characteristics, and circumstances. Being culturally aware helps behavior analysts achieve meaningful goals, such as reducing disparities in access to services and improving the quality of services for diverse populations. Hold on a second. I'm sorry. Yes, okay. And improving the quality of services for diverse populations and behavioral health systems. Cultural awareness is important because behavioral patterns that are viewed as problematic in our own culture may be the norm in other cultures. And I think all of us kind of have experienced that in either this field or even just in our own personal lives and relationships with others. Being culturally aware may also increase the probability that behavior analysts will engage in behaviors that are socially acceptable to people from diverse cultural backgrounds. Increasing cultural awareness may also decrease the probability of behavior analysts expecting the clients they serve to conform to their own cultural and scientific values and contingencies. Awareness of cultural differences and similarities may allow for programmatic modifications that result in more culturally appropriate models of behavior analytic service delivery. So, developing cultural awareness in ourselves. The American Psychological Association's multicultural guidelines encourage clinicians to recognize that as cultural beings, they may hold attitudes and beliefs that can detrimentally influence their perceptions of and interaction with individuals who are ethnically and racially different from themselves. Developing self-awareness can help prevent our biases from impeding how we serve culturally diverse clients. So, talking about our diverse client interactions with a professional community in group discussions, mentorship meetings, journals, self-reflective exercises, just to name a few, are all ways that we can develop our own self-cultural awareness. Being mindful, clinicians should hone their ability to attend closely to clients and clinicians can engage in more culturally aware practice by assessing, collecting data, and testing hypotheses rather than accepting their own experiences and biases as the norm. And several self-assessment tools that behavior analysts can use to become more aware of their own cultural identity. So some assessments are diversity self-assessment, how do you relate to various groups of people in society, multicultural the sensitivity scale. And I highly recommend going and taking one of these self-assessments. I had to do it for my class, and it was, again, an eye-opener to see, you know, you kind of think being in this field and dealing with so many different cultures of families and even therapists and people you work with, you try to be more aware of like, okay, I'm not holding any like biases or things like that. But with these assessment, you know, that unconscious bias, it's there. And so it's kind of helped me become a little bit more aware too, like, oh, I need to be more careful in this area. And here I just have a quote that altogether, behavior analysts may find these assessments helpful in further developing their own cultural awareness in order to further develop culturally competent methods of service delivery. I think there's a chat. Thanks. So again, developing cultural awareness of clients through culturally aware assessment practices may allow behavior analysts to obtain important cultural information about clients in order to understand their world views. Culturally aware assessment may also allow behavior analysts to identify potential cultural barriers, such as modalities of communication and expression of emotions, which we already know children with autism have those barriers of communication and being able to express their emotions. So to increase the probability that assessments will identify cultural variables, behavior analysts are recommended to focus on functional relations and behavioral principles rather than topography. Here I provided an example that it says Filipino families often live with extended family members, and the household situation can be a little bit chaotic. I've actually witnessed this myself personally, and with this example, if a child has difficulty sleeping, a behavior analyst may advise the parents that they should separate the sleeping room from the living room. But kind of knowing the culture of Filipino people of Filipino descent may be shy about responding to someone in a position of authority. So they might just say yes to that behavior analyst. But during the following session, it is revealed that the parents did not change anything and the child is still sleep deprived. So it may seem that the parent isn't following through and the behavior analyst can become frustrated, but also kind of being aware that the intervention recommended may not have been culturally appropriate due to the fact of their living situation. So behavior analysts need to be aware of the differences that may exist, including cultural differences between the behavior analyst, the client, and their families. Specifically, behavior analysts should be knowledgeable about the client's culture, differentiate between an unfamiliar cultural norm and a pathology, and take culture into consideration during the therapeutic process. Here we have that communicative competence is related to an individual's awareness of the laws of language, structure, and language use within a given culture. knowing that communicative competence is related to an individual's awareness of the laws of language structure and language used within a given culture, behavior analysts should be skilled in sending and receiving cultural communications. And we will go through some recommendations on the next slide. So, recommendations. Language of assessment. It is important throughout the assessment and treatment to communicate in a manner easily understood, culturally aware, and does not include terms that are culturally inappropriate or confusing. So we all know not to use, behavior analytic terms, especially trying to build rapport with parents. They're coming to us for a reason. They know what we're doing. We don't need to be using big fancy words to try and make ourselves look good. We're there for them. We need to build rapport with that family. So we need to make sure that the way that we're communicating is not only easily understood, but being able to communicate with them respectfully and how they communicate in their culture. And another recommendation is to understand cultural identity. So consider the client and client's family and community are all important sources of acquiring and understanding the cultural identity of the individual. So it is important to highlight that the client family's language is a critical cultural variable that should be understood in addition to collaboration with other stakeholders or other people involved in the child's life or who you'll be working with. And I do want to say, that language isn't being able to speak a different language, but understanding some cultures, they don't make eye contact, or they, I've personally had two, if it was a male and a female, the father would make more eye contact with the male than the female, and I didn't take offense to that. I just knew that was part of their culture. So, always being aware of those things. Readily available resources. So create a more culturally aware functional behavior assessments. So this is good for us to know when we are assessing our future patients. We want to involve family, community members, and professionals to learn about the client's culture and examine possible socio-cultural explanations of that behavior that we're looking at. Behavior analysts attend trainings and engage in cultural activities. Here I kind of laid out the proposed standards for cultural competence in behavior analysis. I again think these are important standards to go by. Number one is that it's ethics and values. So behavior analysts should function in accordance with the values, ethics, and standards of the profession, recognizing how personal and professional values may conflict with or accommodate the needs of diverse clients. The self-awareness, just what we've been talking about, being aware of our own personal cultural values and beliefs as one way of appreciating the importance of other multicultural identities in the lives of people. Cross-cultural application, so being able to appropriately use culturally sensitive methodological approaches, skills, and techniques that reflect the professional's understanding of the role of culture in the life of the client. Diverse workforce, so we want to support and advocate for recruitment, admissions, and hiring and retention efforts in behavior analytic programs and agencies that ensure diversity within our profession. Language diversity, so being able to seek and provide or advocate for recruitment. Oops, sorry, that was a mistake. I will get back to you guys on that one. Cross-cultural application. So behavior analysts should advocate for and participate in educational and training programs that help advance cultural competence within the profession. Similarly, they should have and continue to develop specialized knowledge and understanding about the history, traditions, value and belief systems, scientific heritage, and artistic expressions of major client groups that we serve, and referrals. So behavior analysts should be aware of personal and professional limitations in working with multicultural clients, making appropriate referrals, and seeking the advice for those with specialized knowledge of the client's culture. So just what we do whenever, we might get a client whose behaviors that we might not be that competent in, or, we are just not too comfortable doing. It's the same with the client's culture, making sure that we are finding all the resources that we can to provide the best services for our clients. So in conclusion, just two quick ones I wanted to note was that it is important for behavior analysts to not make gross generalizations about clients or their families based on the cultures they represent. And it is important for a behavior analyst to continue to develop their cultural awareness skills by systematically ensuring ongoing training, experience, and supervision for cultural competence and awareness. I also have references on articles discussing, our cultural diversity, how to be more culturally aware in what we're doing. There, again, like I said, there's little resources on how to actually implement cultural awareness in like the clinical setting. So kind of discussing it and bringing it more to light, I think is a way that we can kind of make it more aware and potentially get more people involved in, doing the research on how we can provide this cultural awareness within our services. So
thank you so much, Justine. I'm going to turn off the recording just so that we can openly ask you questions and pick at your beautiful brain. And we thank you so much. For more information and resources, check us out on our YouTube, Facebook, and our page at colehealth.com. And we do offer free parent empowerment webinars each month and resources. And always feel free to reach out for any of those services that you need. Thank you so much.